seriously. The Chief Medical Officer of Health, Dr. Hanley, and the Deputy Chief Medical Officer of Health, Dr. Elliott, will each have a statement, and then they will entertain some questions. So, again, based on last week's press conference, if we can just identify folks who want to ask questions, and we will ask you to speak up. One of the criticisms we had was that it was very difficult for people who were watching the live stream to hear what the question was being asked. And Dr. Elliott and Dr. Hanley will try and repeat the question back before they answer it, but just in case, we ask you to speak louder. Thank you.
Thank you. We've come so far in so short a time. And it seems like almost months since Dr. Elliott brought what was then the surprising and so sad news that we had to cancel the Arctic Winter Games. And such is the inevitable march of an epidemic that hardly a week later, we're seeing cases coming closer and seeing the need for action as not next month, not next week, but today. Let the Arctic Winter Games rally that happened yesterday be a last mass rally for support and solidarity as we go forward. Yukoners, COVID is now in all the provinces, and only our 3 territories have yet to announce a first case of COVID-19. But let's be clear, this is coming to Yukon and could well be here without us knowing. We're at a pivotal moment in Yukon's history where a collective, strong, determined, and unified response is necessary. Now is the time to pull together. As Dr. Theresa Tam said, it's time for concerted, massive action, and I will outline what we need to do today and in the coming weeks. We will likely need to do more, so what I'm going to announce today is only the beginning of our ramped up response. By doing this together, we will save lives. Our motto might be solidarity in self-isolation. Team Yukon needs to work together by creating and even celebrating social spacing as a community effort. As you know, we're already asking people not to travel outside of Canada. And yes, as due precautions require, that does include not visiting our Alaskan friends next door. People who are already traveling internationally and arriving back to Yukon are, as of last Friday's federal announcement, being asked to self-isolate for 14 days in addition to the specific travel advisories previously in place for the higher risk countries. As a reminder, and we'll go into this in more detail later, self-isolation means staying home, avoiding having visitors, keeping your 2-meter distance from other household members, washing your hands frequently, and keeping your coughs and sneezes to yourself. In addition, if you are sick, even with a mild cough, or if you have been traveling outside Yukon during the prior 14 days, you should not visit our healthcare facilities. Active screening is taking place at the hospitals. In addition, for long-term care, for the time being, we are asking that there be no visitors, including volunteers, to long-term care unless family members are at the end of their lives or gravely ill, regardless of travel. In other measures, if you have traveled outside of Yukon, as a public measure, please keep a respectful 2-meter distance from seniors, elders, and others who may get more sick with the coronavirus. In other measures, if it's possible for you to work from home, then please start working from home. Yukon government will be providing support for public employees to work from home where feasible. Other employers are requested to examine any mechanisms possible to facilitate employees or contractors to work from home. Essential workers, such as long-distance transport workers, healthcare workers, first responders, critical infrastructure workers. For these people, we will be applying mechanisms to identify and allow such workers, when needed, to return to work with self-monitoring in place following a risk assessment to ensure that this can be a safe practice. Additional measures. If you have a child or children in camp or daycare, and if you can keep them at home, then please do so. If you need camps or daycare to carry on, then please continue to do so. But fewer kids together at camp or in daycare is going to be safer for all. Mass gatherings of more than 50 are now banned, including worship services of this size or more. For smaller get-togethers, we advise the following. Seniors and people with underlying medical conditions should avoid gatherings. Avoid social gatherings where you cannot be separated by 2 meters or more from others. For bars and restaurants, we are asking you to be aware of social distancing rules and to keep capacity low enough for people to be well spaced. Physicians are starting and being actively encouraged and in fact starting to use telephone care and virtual visits where feasible for their patient visits, and they will be reimbursed for these visits appropriately. A new virtual care app has now been made available to enable physicians, if not appropriate to provide care by telephone, or if preferred, safe virtual care is now also available. Lots to say here. Those are the measures, and I'm going to pass over to Dr. Elliott for comments on some of these specific provisions, and then I'll give some closing comments before we go to questions and answers.
Thank you, Dr. Hanley. Merci. Un peu en français d'abord. Le docteur Hanley a dit que COVID est maintenant dans toutes les provinces du Canada, et c'est seulement les 3 territoires qui n'ont pas encore annoncé un premier cas. Mais restez assurés, et pour clarité, le COVID va venir à Yukon, et ça peut être ici déjà et qu'on ne savait pas. Maintenant, c'est un moment critical dans l'histoire de Yukon. Un moment quand il faut que nous tous travaillons ensemble, fort, déterminés et avec une réponse qui est unifiée. Maintenant, c'est le temps plus que jamais qu'il faut se tenir ensemble et se supporter. What that means, in part, for people in their day-to-day lives to pull together is to think of all the people who have been affected here and around the world by this disease. Think of the critical workers who continue to work, the healthcare workers, the people in the transport sector, and support those people. Are part of our community and a critical part of the community infrastructure that keeps us all going. Perhaps they need help with caring for their children, with getting groceries or other things. This is the time to reach out and to thank them. Notre motto peut être solidarité en auto-isolation. L'équipe Yukon, faut travailler ensemble et créer, même célébrer l'espace entre nous comme un effort communautaire. Auto-isoler, c'est-à-dire ça. Rester à la maison. N'invite pas les visiteurs, prends ton distance 2 mètres aux autres dans ton maison, votre maison, et lavez les mains fréquemment. Restez les tout et les achou à soi-même. Perhaps I'll go into a little bit of explanation of the measures and some of the terminology that's in the media right now. One of the things we hear over and over again is we want to flatten the curve. I'll just go into a little bit of what that means. When an epidemic goes through a population, often what you see is a very rapid increase, and then as more and more people are affected and infected, fewer people, and people develop immunity, fewer people get affected as it decreases and runs through a population who's never seen a disease before. With the measures that we're introducing today, and that we'll continue to introduce over the coming days, the goal is to decrease how quickly COVID-19 spreads from person to person. That's what we call flattening the curve, so each day the number of cases is fewer. And we also are working to delay the introduction into Yukon and delay the spread from person to person, so that's pushing the curve out. These measures are critically taken early, and what's challenging and what we're asking you to do is to take this seriously now in order to save lives, in order to prevent a possible harm in our society. All of us working together can really save lives. I think the other thing we're asking is for some patience. This is a rapidly changing epidemic. It's a time of great uncertainty about certain aspects of the disease. And that we might say something today that might be different with some uncertainty, and then as the disease evolves, we'll have better certainty. Peut-être quelques autres choses en français. Si vous êtes malade, même si c'est faible, une faible maladie, et si vous étiez dehors de Yukon dans les 14 jours en avant, il ne faut pas visiter les hôpitaux ni les facilités des âgés. De plus, pour les soins de longue durée, pour le moment, nous demandons qu'il n'y ait pas de visiteurs, y compris les bénévoles, au SLD, sauf si les membres de famille est en fin de vie ou même gravement malade. Si c'est possible de rester à la maison, même pour travailler, même garder les enfants à la maison, hors d'écran, hors des activités, faisez ça, s'il vous plaît. OK. C'est vraiment le moment maintenant en Yukon de être en solidarité et même temps à distance de nous l'un de l'autre. Merci et on est prêt pour les questions s'il y en a des questions.
I'll just give a few more words before we go to questions. And we will, on peut recevoir des questions en français ou en anglais. Some of us were born here, some of us came here for a little while and stayed. And some of us trace our ancestry here for generations or even centuries. But we're all here because we love the land and we love our community of Yukon. Although I have heard people expressing doubt and fear, I've also already heard incredible stories of strangers helping strangers in this recent struggle. But of course, none of us are really strangers here. We all belong and we're all Yukoners. For now, we need to overcome fear with reliable information and uncertainty with solidarity. Bien que des gens expriment des doutes et des craintes, j'ai également vu des histoires incroyables d'étrangers aidant des étrangers dans cette lutte. Mais aucun de nous n'est vraiment étranger ici. Nous appartenons tous et nous sommes tous des Yukonais. Pour l'instant, nous devons surmonter la peur avec des informations fiables et l'incertitude avec la solidarité. The love of the land and the love that we show for each other, that's what is going to get us through this. As Yukoners, we will use whatever talents or skills we have to help those who need more help than we do. We'll work, We'll still ski and walk, our children will still play, and so will we. We're still parents and families, and we'll still be able to do many of the things that we love to do. We'll get through this together. We will have some losses, some shared pain, perhaps some grief. But by working together, we can also share the joy and satisfaction that we will get when we turn back the tide of this epidemic. We'll once more get to that place where we can again rally and wave the flag, celebrate in the company of each other, hug strangers again, show off to the world as artists and athletes, and show our pride. Team Yukon, it's now or never. Merci, Jonathan. Thank you.
We can go to questions now, please. I will also give you a reminder that the Premier will be speaking very shortly after Dr. Dutz and Dr. Elliott. Dave?
Hi, Dave Croft, CBC. Is this, when you say it's a process, so people might question, well, why not gatherings like bingos be banned? Why are bars still allowed to be open when they're obviously not that suited to social distancing, I wouldn't think, depending on the number of people inside? How come not take those extra steps to keep people congregating together?
It's a good question, and I think we're looking at incremental response and still trying to have a measured response. We know that there's a lot of what might be harsh news coming out of today's out of this news today, and I would say stand by. We obviously want to still continue the idea of a measured response. A response that is compatible with where we are in the epidemic, and very cognizant of changes around us, changes on the national scene. I think for today that this is these are the measures we need for today, and let's see what we need for tomorrow.
Julian?
I've got a question. You said gatherings over 50 are banned. So what happens when it comes to schools?
Yeah, it's a good question about schools, and we are having an urgent discussion about schools. Of course, we do have a little bit of time with the kids being on spring break for us to make a good decision on schools. Look at all the options, and we think by the middle of this week we will have a recommendation on schools.
Got a follow-up?
Follow-up?
This morning, the Prime Minister said the borders are closed to non-citizens, the exception being U.S. citizens. We're very, very close to Alaska. You're urging Yukoners not to travel to Alaska. How does the opposite play out here? What are you doing by way of informing Alaskans coming here, or Yukoners when Alaskans come over the border to Yukon?
Yeah, I mean, obviously it's very fresh information, so we kind of have to process this, and then and obviously a lot of this is federal border actions, not local actions. But yes, we need to have a coordinated answer to that.
I think a number of people, the questions today were around what are we doing in public health in terms of recommendations for mass gatherings, schools, and other events. I would also ask every Yukoner to ask themselves what they can do. The request is that people do keep a distance from each other. I can tell you myself, I've been adapting to this and it's challenging. And the request, yeah, exactly. The request is also to avoid mass gatherings over 50 people and avoid those where you cannot keep a distance of 2 meters. So that's something to really sink deeply into what people are thinking. If a person is elderly, senior, or with underlying medical conditions, I'm asking every Yukoner to be extra considerate of those people. They are high risk of severe disease should they become infected. So many of these measures are requests. We're asking, we're telling people they must do these things to protect Yukon. And I would add that the critical moment is now for every one of us to take personal responsibility and to work together, because it will save lives.
Obviously the situation isn't good, but confidence level still the same as it was that if and when cases start appearing, that Yukon will be equipped to handle it?
Yes, I think we have mechanisms to handle rising cases, but at the same time, we, like any other small jurisdiction, have limitations in our healthcare capacity. So there is a chance that if this was out of control, if we had 30, 50, 70% of the population affected over a short period, that it could overwhelm our healthcare infrastructure. And so that gets back to the, and that's normal, whatever the size of the population match to, you know, whether we're talking about Toronto or Whitehorse, we have health facilities that are geared to the population with a certain amount of surge capacity. So obviously in the, we are very hardworking, again, as I mentioned a few days ago, on surge capacity, alternate facilities for care should that be required, intensive care capacity, transport, all of those issues that we have to be we have to be ready to respond if we hit critical points of need. From a public health point of view, we are well equipped to take care of cases or clusters of cases, and to continue with the philosophy that we talked about last time, the strategy, which is contain clusters and delay and prevent spread. So none of that changes, but we have to be very cognizant of the need. The weapon that we have is the public response, the social measures. Flattening the curve means we can avoid that crunch on the healthcare system.
If I can just remind folks to please repeat the question. You guys, if you could speak very loud, and if you hope to repeat it, we've had a couple of emails already that, okay. Tim?
Tim Kacharik from CKRW. I've heard through a few people that they are showing symptoms. They're calling 811 and they're not either getting a test or they're not really getting much of a reaction. Can you speak to that? And as a quick follow-up, has there been an increase in the number of tests that have been done?
So the question was regarding wait times when you call 811, or perhaps advice around testing. We are encouraging Yukoners who feel that they may have been exposed to COVID-19 through travel or other areas to call 811 for testing, advice and general advice about coronavirus. We're also encouraging people to go to our website for frequently asked questions, and to call the Public Health Agency of Canada line for general information. So for those people who do not require health assistance, please use other means than 811, because 811 is very busy right now across Yukon. We are continuing to test people according to our current criteria. We've completed over 100 tests, and we have about over 100 tests also. We're waiting for the results on those. We still have no cases in Yukon.
I'll just add to Tim on the 811 line that we recognize this is an issue, a problem, and there is some urgent work being carried out to have more of a streamlined access, a kind of a one go-to number, as that can then be triaged into, is it an information need, is it a question, do I need testing, or is it, how do I arrange testing, and really have those sort of three questions sorted out. So we hope to have this remedied very shortly to meet the demand of our population.
Gabrielle?
What measures are being taken for more vulnerable populations? What's happening at seniors' residences and also the homeless shelter?
The question was about how we are addressing our vulnerable citizens and our elders, including facilities. So as I mentioned in the beginning, that we have specific provisions for long-term care, for visitation of long-term care, and that is that we are asking that there be no visitors, including volunteers, to long-term care, unless the person being visited is gravely ill or at the end of life. And in addition, we're asking on the public measures side to keep a respectful distance from seniors and elders, just recognizing that vulnerability. You also asked specifically about the shelter, and there are very active arrangements being made on, again, surge capacity for the shelter, isolation if that is required within the shelter. How would that work? Where would they go? There is space that can be arranged for that within the shelter. So we're very aware. We also will be ramping up our general capacity to answer specific community needs, like what if there's a case or a cluster of cases within a community, how would isolation work, where community nursing and the health center nurses are very engaged in this conversation, but we want to make sure that people feel comfortable, whether in communities or in Whitehorse, with the arrangements that are in place to accommodate isolation and the needs of people being isolated when required.
I wanted to add something to what Dr. Hanley said. I think when we're thinking about covering our coughs and sneezes and staying away from people when we're sick, we also need to think about allied healthcare professionals, dentists, optometrists, physiotherapists, and keep away from all of these people who help us in our day-to-day life for anything that's not critically urgent when we are sick. And by sick, I mean a little bit sick. A little cough, a slight feeling of a fever. Please do protect all the people in our society by staying away if you need to be within 2 meters for a non-elective service.
Marianne?
Juste en français, s'il vous plaît, Radio-Canada, faisait attention par rapport aux écoles, ce qui est envisagé.
Pour les mesures pour les écoles, oui, la question c'est est-ce qu'il y a des mesures pour l'école? Et on profite maintenant de la pause, de 2 semaines de pause, les vacances pour les enfants. Et donc on va, dans les 48 heures qui viennent, faire une analyse basée sur les besoins éducatifs, les besoins ruraux comme urbains aussi, pour avoir une décision. Qu'est-ce qui est la meilleure solution pour les écoles après la pause?
Aussi, je veux dire en français, pour les gens qu'on a introduit la possibilité pour les gens de visiter leur médecin virtuel, même au téléphone ou même sur l'ordinateur.
Okay, I have 4 more names, and we'll work through those, and then unfortunately we're going to have to call an end, if you don't mind. Dave, you were next.
What's the legal authority for a ban as opposed to a request? And how would any bans be enforced?
For a ban, it's as of today, it's really a request. We haven't yet looked at the enforcement measures. We could, under the Public Health and Safety Act, enforce it. I suspect that there will not be compliance issues with this. If from what I've been dealing with over the last few days, it's more perhaps even the other way around. That people are very aware and very concerned about the risks. So I guess my golden rule is use the Public Health and Safety Act when required. When voluntary measures don't apply. There are also various civil authorities we could use, but it's really the least enforcement needed to get to our goal. But we will be for sure, listening to our public and watching for the need to step up enforcement if it arises.
Julian?
Emphasizing people working from home, I wanted to ask about supports for public servants and for workers who don't have such supports, who can't take paid sick leave.
So the question was about public servants and the supports that may be in place for them to work at home. And from the point of view of Yukon Territorial Government, I think that there will be more information specifically for Yukon government employees that will be going out shortly, if it hasn't already, to talk about the supports for people to work at home, as well as many other issues associated with, say, leave and compensation for leave. So I don't even know the details of that, let alone go into them for the purposes of this conference. But it's certainly an important question for other employers to work out, both from a kind of an infrastructure point of view, but also from other supports that may be necessary to help people work at home. Again, we're moving quickly with the measures, and so we're asking employers to look very quickly at what they can do to support this.
Tim, and then Aurore Montreal, and then we'll have to shut it down.
I know you mentioned off the hop about the Team Yukon yesterday, and that being the last gathering for a while. A lot of Yukoners can't get their heads around why this was allowed to proceed. Can you walk us through the rationale to allow that gathering to happen yesterday?
Yeah, there was some angst about it, but it was also socially a very important occasion for people to move on from the cancellation. So what we did was we talked with the organizers. We talked about social distancing. We knew that this was an outdoor event. We knew that we were at a good point in the epidemic, and that we again emphasized just before the event with the organizers and with the public through social media some of the basic requirements. So I really saw this as a kind of an exercise in what social distancing can look like. Now, we recognizing at the same time that it was a kind of a send-off, because really, even though there are no cases here, there's no proven transmission, we have a gift right now, and that gift is that we're a little bit ahead of the game, and we have to try to stay that way.
Oui, vous avez parlé des écoles. Moi, je me demande, est-ce que vous êtes dans le même processus décisionnel pour les bâtiments publics à haute circulation comme la bibliothèque ou le Canada Game Center?
La question, c'est pour les autres facilités comme Canada Game Center ou j'ai pas entendu la bibliothèque. Oui, on est en train de considérer tout. Parce que, et peut-être le plus important, est-ce qu'on a les moyens de mettre en place les mesures nécessaires pour avoir la distance entre les gens quand ils sont à l'intérieur. Donc, c'est possible qu'on peut mettre en place des mesures et garder ouvert. Et c'est une mesure qui doit idéalement correspondre aux gravités de l'épidémie. Donc c'est toujours une balance d'appuyer les activités, mais le plus important c'est de garder le principal de la distance sociale.
We've just been asked if you would give the same answer in English.
I can give it.
Sure.
The question was regarding other social facilities, such as the Canada Game Center, the library. Will we have measures in place? I think one of the things that's really important to know now is that we do not have a diagnosed case of COVID-19 here in Yukon. There may be a case that we are not aware of yet, and that is why, in some ways, we are implementing these measures now. We are certainly not in the same situation as other larger jurisdictions in Canada, larger provinces and territories. So when we look at this places, the facilities such as the library, the Canada Game Center, we are working closely with them at this point to determine the best way to keep them safe and, if possible, keep them open. We have a gift right now, a window of opportunity. we have a window of opportunity to look at these things. We will be acting quickly. However, we are fortunate at this moment that we can act with a bit more of a measured response and a little bit more time for a risk assessment than other places in Canada.
Thank you very much. As a reminder, the premium will be coming in shortly.
Thank you.
We're gonna do a quick scene change to a podium. Cam, can you switch it to the podium?
I still think we should all be told to just go home and stay there.
I'm just gonna sneak by you here. Thank you.
Yeah, sure. Okay, we're just gonna move the table out that way. I'll say detail on. It's all right, thank you. Thanks, Mark.
C'est juste que je pense qu'on a juste 5 positions sur le fil en continu. Fait que plus tu tweets, plus tu sors. Mario, son tweet en verra plus. C'est pour ça qu'on dit toujours 2 tweeters. Ce que je fais souvent, c'est qu'au début, je l'annonce avec photo. Puis après ça, j'attends des fois plus la fin de la conférence pour voir qu'est-ce qui est sorti. C'est quoi l'information la plus pertinente. Toujours avec photo, parce que sinon, ce qui arrive, c'est qu'on voit juste ton puis ça fait un gros trou blanc là-dessus. Mais dans un contexte de breaking news, je veux dire, c'est acceptable.
Oh, I see, I'll check in. Unfortunately, I think we only have 2 minutes.
Great when they do.
We're short enough for her to see procedure. I'm happy to go line 2.
We only have one stand here, though.
We're gonna aim to have gone over.
That was a question from the audience. Oh, that's great.
We're being responsive.
Well, let's pause 1 second.
Sure, I'll wait till you give me the
Okay. Oh, okay, all right.
Hello, everybody. Thank you very much for gathering today. We have two things to talk about today. One, I just wanted to talk a little bit about the conversation I've had with the leaders of the opposition parties. Together today, we have agreed to work very quickly through the interim supply bill and the supplementary budget and Bill number 8, Budget Measures Act, so that we can move directly to conversations on the 2020-2021 budget. We're taking this precaution in the event that our Legislative Assembly has to stop meeting with very short notice, although that is not the case so far. And so if you have any questions specific to that, then I can answer those now. But I do want to thank both the NDP and the Yukon Party for quickly working together to make sure that the finances in the supply bill and the interim supply bill and Bill number 8, which have huge implications for the business community, can flow. And so again, thank you to them for that. Any questions on that before I get into the substantive measures that we're going to announce today? Okay. As you have all heard from Dr. Brendan Hanley, Yukon's Chief Medical Officer, the situation of COVID-19 is rapidly evolving. Much has changed since Yukon became aware of the coronavirus back in December. Our government has been working with our healthcare professionals, taking our lead on all health-related issues from the Chief Medical Office of Health. I'm incredibly confident in Dr. Hanley and Dr. Elliott, and I appreciate the work that they and their teams are doing. We have also been talking with our neighbors, our constituents, our families. We are hearing that Yukoners are worried. They are worried about the health of their neighbors as well and their families, and they're worried about what's to come next. What I know is that we have an excellent professionals like Dr. Hanley and Dr. Elliott monitoring and responding to this situation around the globe. These professionals are telling us to take precautions, to remain vigilant with our hygiene, and to monitor for symptoms and to self-isolate it if needed. Today, the Prime Minister reiterated that all Canadians returning from international destinations should self-isolate for 14 days. This direction is clear and strong. With this direction comes another area of worry, this time from our local businesses and workers who are employed by these businesses. We have heard from them too, and today I am announcing supports to help ease their worries. I am announcing $4 million support package aimed at easing the impacts of COVID-19 for workers and businesses. The support package will make compensation available for all workers who need to take sick leave but do not have paid sick leave options. This will make money available to support workers for up to 10 working days, enough to cover a 14-day isolation period if needed. This package also supports businesses in several ways. We are waiving and reimbursing certain government fees to reduce business operating costs and stimulate the tourism industry. We are establishing a grant program to reimburse businesses for losses related to the cancellation of events due to COVID-19. All workers' compensation, health and safety premiums will be deferred, and prepaid premiums will be reimbursed. We will enhance local tourism marketing efforts to support cultural industry by honoring transfer payment agreements. To monitor the impact of COVID-19, we will establish a business advisory council to gather information and to share back to government. We are also assigning staff to be on hand at the Eric Nielsen Airport to strongly advise incoming passengers to self-isolate if they are returning from outside of Canada. The support our government is committing today will help Yukoners. It will help Yukoners workers who do not have access to paid leave, and it will support Yukon businesses negatively impacted by this situation. We can all appreciate that COVID-19 will come to Yukon, and I have full confidence in our medical system to support Yukoners. Yukon government support, we support our medical community and our healthcare workers to keep doing the incredible work that they're currently doing. In addition to support for health, we also now need to look to community supports. We know that local businesses, they need to persevere through this situation. We need workers to have jobs to return to when COVID-19 runs its course. We need tourism operators to welcome visitors when it's safe to travel again. We need Yukoners to feel able to self-isolate if needed, and we need people to practice social distancing. We need artists to be able to support themselves because artists make our communities great. We need Yukoners to purchase goods responsibly and to avoid unnecessary stockpiling. The support announced today, combined with the $2 million saved by tax reductions and the $2.4 million saved by income tax reductions that we are proposing in Bill 8, will give Yukon businesses the support that they need to survive this situation. Pair this with our proposed $369 million in capital spending, I am confident that we can keep Yukoners working. Yukon is a very strong community. We support each other. We check in on our neighbors, and we reach out to people who are in need. I know that Yukon will come through this difficult time even stronger than we were before, and I'm very happy to be able to contribute to the success with the support package from this government. Thank you very much for your time, and I'll open it to the floor for questions.
Do you want a microphone?
Sure, since nobody can hear the questions here. Tim Kacharik, CKRW. Can you just elaborate, I'm sure some others will ask about the aid packages, but can you elaborate just on the airport and getting people up to the airport? Is that happening right now? I mean, there's midday flights coming in, so can you go through that and who's going to be there, how many people are going to be there, what's going to be happening at the airport?
Yeah, so again, as of this announcement, we're moving into action based upon the advice from the federal government and also our medical community as well. So the Department of Highways and Public Works will be working on this and making sure that we have people in place to make sure that Yukoners who may not have looked at the website or who are traveling and without knowing the provisions that are necessary as far as self-isolating, that will be invoked right after this meeting, basically. So this announcement allows that work to start.
Hi, Mario. It's Joe with Radio-Canada. At this point, what are you asking the federal government? Trudeau had an announcement this morning. I think he mentioned with having talks with Minister Vandal about protecting the North or something like this. So what is the Yukon asking the federal government?
Yeah, so we've had ongoing conversations, whether it be through ECO, my two departments of ECO, finance, community services, health and social services, tourism and culture, you name it, lots of ongoing conversations. Individual conversations with federal ministers before they headed into cabinet as well to talk about what we can do to make sure that the industries are thriving. What we got back from Ottawa, directly from the Prime Minister's office, was we understand that the North is in a unique situation because of our remote populations and the effects when and if COVID shows up in the Yukon. It will have a huge impact on our communities, especially the more isolated communities as you go more further north. The commitment from the Prime Minister's office is we will do what it takes to make sure that the Yukon and the Northwest Territories and Nunavut have the protections that they need. As you know, there was an announcement of $1 billion followed by another $10 billion, and as you see these phasing in of financial aid, that analysis is happening right now as far as how that affects Yukon specifically. We are mirroring and paralleling as much as we can, keeping in close communication with Ottawa on a daily, sometimes hourly basis to make sure that they're aware of the actions that we are doing, the actions that need to be done for Yukon businesses, the tourism industry, and to support businesses and the medical communities.
So can you say at this point if there's something that you need specifically, if there's, what you're asking?
I think the biggest thing today, whether or not funding comes from Ottawa, what we're identifying right now is the need for us to support workers. Making sure that our own government employees know exactly what they can do when it comes to sick leave, and also government or non-government workers, people that are working in the tourism industry, people that are working in sales and transportation. They now know that this government will give them the leave that they need. Because really that's what we're asking. We're asking people to self-isolate. We're asking people to monitor for symptoms and to get tested if they need to. And now we are providing the financial wherewithal for those workers to do so.
Okay, so paid sick leave for workers. Does this, what workers, what type of workers does it affect? Is it all sectors?
All sectors.
All sectors. Okay, and how soon will it be rolled out? Is that happening happening today? Can you just sort of unpack it a little bit more?
Yeah, so again, as of this announcement, now there's due diligence is being done as far as the work, but we had a management board meeting this morning to announce, to allow these funds to flow, and so immediate action will be taken. Yeah, Chris.
Chris Windu from CBC. Just to back up to the budget stuff, can you just sort of lay out, I guess, is there like a list of priority items that have to be voted on before other things?
No, like, so again, working with the opposition and again, having conversations with both leaders about the urgency to get money flowing. So that was paramount in the minds of myself and the two opposition leaders as well. So where do we go from there? So today, the focus today in the Legislative Assembly, which is going to start shortly, will be to get the supply, the interim supply bill passed, which gives the financial ability for the government to move from April 1st into 2 months of spending, but also that second supplementary budget for the current fiscal year, ending the current fiscal year. That's important as well. You can imagine as the Department of Health and Social Services waiting for the passing of that budget, they're stretched, and at the same time given the instruction to make sure that they do what they need to do to deal with this situation. So those two are important right now as far as getting money flowing for the budget and for ending last year's budget. But as important is Bill number 8. You know, in Bill number 8 we have the almost $3 million in savings in income tax for all Yukoners. We also have the $2 million in savings to small businesses by reducing the small business tax from 2% to 0%. It also has the provisions to help support investment in local businesses like Air North as they look towards reducing emissions by buying more fuel-efficient planes. So really important budget situation that we really need to work together non-partisanly to get these items passed. And again, you know, hopefully by the end of the day we'll see assent of those two important budgetary considerations and that really important tax measure as well. Any other questions from us? Okay. Thank you very much for gathering. Yeah.
So, Vince Whitehorse, so somebody in the non-government sector, how fast can you get payment to them?
So good question. This is unprecedented in our history. And as of today, as of now, that money has been given the go-ahead, and so right away that the information we shared with the private sector, with businesses, and we'll get that money flowing as soon as possible. But again, to say that I have a time during the day that we know that that's conservative. As of now, it's available. So businesses will grant the leave, and then they will apply, and that way that they can make the decision right now, knowing full well that this government will have their backs when it comes to that support. So again, if you are in that private sector, make sure you're doing the right due diligence, make sure you're doing what the medical community says to do if you're experiencing symptoms, those types of things, because the money will be there for leave revisions. Okay. Thank you very much, everybody. Really appreciate it.